Welcome back to AM Northwest. When it comes to treating chronic pain, our next guest knows what she's talking about because she's been there. Here to share more, we welcome back from Pain Relief Partners, nurse practitioner and owner, Stephanie Jones. Good to have you with us.
Thank you.
You have your own personal story of growing up with pain, so tell me a bit about it.
Yeah, I have a condition called Ehlers-Danlos Syndrome, and it's the hypermobility type. There are several different types of EDS, and that just means my ligaments are extremely lax, so my joints come out of place a lot.
Wow.
Yeah, so as a kid, I could do funny things like spread my toes as wide as my fingers and cross them like my hands. And
wow,
yeah,
that's a cool party trick.
It is. I perform that in talent shows sometimes.
Yeah, that's wild.
Yeah, so I could do that, and I would, bend my fingers back too far in basketball or volleyball, or extend too far in volleyball. So my first kind of back injury happened in high school when I was trying to hit the ball, and I would just arch back much farther than I should have been able to.
Right.
My ligaments are just too loose, so they don't hold me in place.
So how did that give you pain? So the back injury you mentioned, right?
Yes. So if a joint comes forward, or like right now my hip is dropped down, and so that just causes pain when your body isn't aligned how it should be.
Sure.
And it's not a simple thing of, let's get you adjusted back into place, because those ligaments are loose and so it will fall back out again. So just a lot of, using braces and other things to help with stability.
And so how did you handle the pain?
It didn't really actually become too painful until my 20s, which is common for some people with EDS. And, then I just thought, I am really flexy, and that's weird. I'm not healing like I should.
Right.
I wasn't diagnosed till I was 38. And
wow.
then when that happened, I was able to look back and think, that makes a lot of sense for
right.
why I would hyperextend and why it took me months to recover from a sprain when it should happen in a few weeks.
Okay, so how do you handle the pain now?
Lots of physical therapy,
yeah.
and then I see our chiropractor, Dr. Kessinger, and he has learned some good techniques to help me stay in place a little bit better. I use braces on my feet, my back, my shoulders to keep them back. And then I've done some of our therapies, regenerative medicine, trigger point injections.
Tell us a little bit more about the trigger point injections, because that's something that you really use a lot in your...
I do use it a lot, mostly because it's covered by insurance, and
right.
a patient can come in and pay a copay and get treated. And so in my case, when my joints are out, that's going to cause the muscles to guard really tight. If my hip is dropped like it is now, then the back muscles on the lower back on that side will get tight, and then on the other side up a little bit higher will get tight, and it's just trying to stabilize my body.
Right.
But that leads to a lot of pain, and so I can inject in those areas and help those muscles relax a little bit, and it's easier.
And how long do you feel okay before you need another injection?
It depends. When I'm out like this, not very long.
Okay.
When my body's in better alignment, it can be weeks before I need another treatment.
Oh, wow. So do you explain to your patients that what you've been through to kind of give them an idea of how you get what they're going through?
Sometimes, it depends upon the relationship with the patient. It's
sure.
not something I'll come out and say on the first visit. By
right.
the way, I understand what's happening for you.
Right.
But, as we get to know each other, sometimes they'll say, why do you care so much about helping me get better? And I was like, I know what it's like to feel like this. And it really gives me a lot of compassion and empathy for our patients. I understand, and I know what it's like to feel hopeless and to be offered a little bit of hope that maybe this can get better.
Yeah, it must make you a better practitioner.
I think it does.
Yeah.
Between that and my mom's traumatic brain injury and the other things our family has gone through, I think I really have a sense of understanding for patients, and they see that and they can tell that we're a different place. And, a lot of our team also has their own chronic pain journey and has been through a lot of things that people who are a younger age typically don't experience. And I think that just gives us a lot of empathy and compassion overall.
How do you feel when someone leaves your clinic and is feeling so much better?
Oh, it's amazing.
Yeah.
I still tear up. I've been doing this for years now. And just the other day I had a patient who said, I can actually stand up straighter, and he has a condition in which he's just progressively going to bend forward
wow.
and not feel well. And, I teared up when he was telling me that. I feel better. I actually had less pain. And he's told all you can do is take narcotics, and he's not doing that, and he's getting better.
That is fantastic. Oh, that's great.
Yeah.
We want to tell folks, if you'd like to find out more, you can contact Pain Relief Partners in Vancouver, 131st, Southeast 131st. The number is 360-975-4680. We'll put all that information for you on our website at k82.com. Thank you so much.
You're welcome.
All right.